Hello, my name is Joy Ashby Cornthwaite, and I will be your host for this episode of the live stream show, MyDiabetesHQ Live. This weekly broadcast is developed and produced by Cities Changing Diabetes volunteers from here in Houston and our sister city, Philadelphia, which recently joined the global network of 25 cities working to improve diabetes prevention, care, and management. You can learn more about Cities Changing Diabetes by going to citieschangingdiabetes.org. The purpose of this effort is to help people with diabetes and their caregivers successfully transition through these very challenging times of COVID-19. Each Saturday, we gather diabetes care experts to discuss and to share their incredible knowledge about diabetes. They have years of experience in self-care, medical care, public health, community health, and advocacy. And we will be bringing this knowledge straight to your waiting eyes and ears. We hope that these conversations will help you gain the tools to build skills to manage diabetes and to live your best lives, not only striving, but truly thriving and doing all the things that you want to be doing. Today's episode is coming right up. You don't want to miss this. Hi, everyone. Remember that the content shared here during MyDiabetesHQ Live is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions that you may have regarding any medical condition. Hello to all you diabetes warriors, champions, and advocates. Welcome to our 10th episode of MyDiabetesHQ Live. We have viewers on our MyDiabetesHQ Facebook and MyDiabetes YouTube channels, so thank you and welcome to our show. We're happy to have you here with us today. Our format today is a conversation. We want to learn about the work of our guests that they're doing in changing lives within communities of faith, and then we want to weave in live questions from you, our viewers. Tell us where you're from and leave us a comment or question below. We will try to get to as many questions during our time together. Even if we don't get to your question during this live episode, please leave it as a comment and we'll get back to you. So did you know that research has revealed that 1 in 4 people who seek help for physical and mental health concerns turn first to their faith leaders before they seek help from clinical professionals? I was really interested to find that out this week as I was looking up information on our broadcasts. Today's show is going to expand upon this statement to understand why and how faith communities are stepping up to care for their members' spiritual and physical health. I will be joined, of course, by panelist Maryanne Strobel. Hi, Maryanne.
Hi, good morning.
She's a fellow nurse, or I'm sorry, not a fellow nurse, a fellow. I'm a dietitian, she's a nurse. She's a registered nurse and fellow certified diabetes care and education specialist with an expertise in disaster preparedness for people living with diabetes. Here to help us understand some of our amazing colleagues and friends. We have 3 Houston leaders from Cities Changing Diabetes Faith and Diabetes Initiative. First, we have Stuart Nelson, VP. Hi, Stuart. Hey. He's VP of the Institute for Spirituality and Health here in the Texas Medical Center. We also have George Anderson, COO with the Fountain of Praise. Hi, George.
Hey there, Joy.
And Serena, she's our hostess turned guest, CEO of Core Initiative here in Houston. Welcome, everyone. Good morning.
Thanks for having us.
Good morning. Good morning.
All right, so let's start this conversation off because I know that this for me, for a lot of us, one of the very first initiatives that stakeholders and volunteers came up with as we sat down years ago to plan interventions for people living with diabetes. One of them that came first and foremost was faith and diabetes. Can either, or I guess both Stuart and George, can you guys just kind of started and talk about why even, why was this something that really resonated with people here in Houston and stakeholders?
Sure, George, you want to start us off?
I'm going to let you go, Stuart.
All right. Well, I think at the very core, we know that faith is sometimes the most important part of somebody's life and experience. It's faith community is often central to family life, to neighborhood life. Faith communities are sometimes the most important source of information. They're sources of trust. And so when Cities Changing Diabetes came to Houston, and we engaged in a innovation round, thinking about what kinds of programs and projects Houstonians would really, really benefit from, we knew that faith had to be a part of that picture. And so, especially since Houston is a city of faith, a high percentage of people report going to worship services on a weekly or monthly basis. There's a high level of people professing a belief in God. People engage in prayer at a higher level in Houston than on the national average, for example. And so we just know that really when we want to talk about something that involves a real commitment to working against, like diabetes, it involves lifestyle change, it involves large-scale public health interventions, it involves really a cultural shift in the way that we as a large community go about our daily lives. We knew that in order for that to be a whole process, faith needed to be a part of that picture. And there's a few ways that faith can be a part of that picture, and so I'll look forward to delving more into that as the session goes on.
Sure.
Super. George?
Joy, Stuart did a great job of explaining. I might add to that, especially here in Houston, the faith communities tend to be a major rallying point for Houstonians, and maybe even for Texans at large. And so, as Stuart intimated, when we look at community collaboration, when we look at just community participation, we see that the houses of faith are very, very strong and very powerful here. And so, for example, when our elected officials seek office, the faith community is the first place that they come to. I would also say, being a Midwestern and coming to Texas, when I look at the faith community, that is where people go to get assistance. That's where people go to get help. And so faith is very much a critical thread in the fabric of Texas. And so for us, when we started Faith in Diabetes, we knew that the churches, the mosques, the synagogues would be a major force in terms of getting the information and getting the education out to the community.
Yeah. And I'd wager to say, it's similar across the board as well. When I was doing some research about our theme today, one of the things that I saw come up often was the intersection of religion and spirituality, especially during these very difficult times. And so there were several articles in the New York Times on it. There were several articles in just local newspapers about how much of a bomb or a boost to wellness people's faith is right now.
It's a great point, Joy. There's a concept called religious coping, and this is the idea that we can draw upon our most deeply held beliefs and practices in times of crisis. And so during a time like COVID, people are engaging in religious and spiritual practices in different ways. We're relying on our communities of faith in order to provide that sense of sort of social support when there's not a lot of in-person social support around. And I think it's really important to remember that with diabetes, people who live with diabetes and pre-diabetes, there can be a sense of isolation, and there can be a lot of psychological kind of components through the experience, and really that also translates to spiritual parts of of that experience as well. And so, you know, for many of those reasons, it's really, really necessary to involve faith communities in any diabetes intervention.
Yeah, and so what I want to do is I want to strike up on that same vein. I want to strike up a conversation between you, Serena, George. I just kind of want to get into, you know, how you all are using faith community to guide wellness, and you know, in the future, what you see, even now and in the future, what you see that turning into.
Well, I might start out by sharing that within all faith communities, all of the sacred texts reference a need to improve your health and improve your life. And in my Christian context, that sounds like, you know, I come that you might live life and that more abundantly. And so one of the things that we have found to be very powerful is that if we take messages of health promotion and wrap them in theology, no matter what the belief system is, that people are more receptive. We're more apt to change behavior, to modify behavior, to improve lifestyle. Because again, if you think about it, if your pastor or your priest or your rabbi or imam says, hey, you need to stop smoking, you're more likely to listen than you are, say, from your physician or your provider. And so I think one of the things that I've been very pleased with is, again, being able to, again, wrap that messaging and show the parallels that go back to the sacred text. As well as the church is a great place of trust. And one of the things that intrigued me with Cities Changing Diabetes was Dr. Linder's research that emphasized the importance of trust. And so you have trust, and especially during these times of COVID, we are getting people asking us, hey, what is the truth? What do we really need to look and regard? So again, I think the faith community has a great opportunity.
Mm-hmm. Yes, just to piggyback off of what George was saying, I've seen in my experience an attempt by some people to separate their spiritual beliefs and their faith from their physical bodily health, and when in fact it comes together. And so that's what the Faith and Diabetes Initiative works to do, is to bring those two things together. That way, when you do that, you go in by faith. It'll get your participants to think on a different level in terms of their physical health. So this is something that is really phenomenal. The initiative is phenomenal in the fact of reaching people who wouldn't normally reach out to any healthcare facilities, any healthcare professionals. You know, a lot of people who have faith and spiritual beliefs believe that their God is going to heal their bodies, and so they don't need medical attention, or they don't need to go seek healthcare professionals. But when we bring those two things together and say, hey, no, you know, and like George said, wrapping the sacred text around physical health, then they'll realize, well, okay, my God also wants me to be healthy. So that's the beauty of this whole faith and diabetes thing. It's this thing is blowing up, and so I can't wait to see how it goes in the future.
Yeah, and so I know you were talking about the sacred text. So this is something that in coming to sessions with you all about faith and diabetes, and in just looking at the way that the curriculum was designed around faith communities and spirituality. Can you all talk a little bit about the diversity and sometimes you know, the similarities that come up because we want everyone to know that all are welcomed in faith and diabetes, right? So whichever way you receive your faith and your spirituality, can you all kind of talk about how the curriculum was developed with the diversity in mind?
Sure. So I'll take a stab at this one. there's a couple things that come to mind. There's kind of a couple of layers to that. The first is that we find that if we're doing an interfaith initiative, many times it's really great to have a kind of a neutral common meeting ground for people to congregate around and within. And so we made a choice early on to make the Institute for Spirituality and Health, the place that I work, kind of that meeting ground, because it's an organization that explicitly says that we're an interfaith organization. So faith communities that may not encounter one another all so often, or interface or collaborate with each other also often, have a chance to come to a space that's kind of a blank canvas. It's a place where whatever colors you're adding to that canvas, you can do so. So that's an important part of that, is creating a container, creating a safe container for an interfaith process to unfold. The second thing is that, when we do a Faith and Diabetes initiative, I say a lot of times that there's a reason why it's called the Faith and Diabetes Initiative. It's not just called the Diabetes Initiative. And that's because we really take pride in and understand the value of and really delve into the importance of faith in this conversation. I think often faith communities are used as a kind of just an infrastructure, or they kind of objectify faith communities as just a place to do work, without really understanding that those communities are bound together by very deeply held and historic beliefs and practices that are so important. And in the language in Faith and Diabetes that we use, we often say that those are special things. So communities of faith have across the board special texts, like George was saying, special rituals and practices, special people, figures who are important, special times and seasons. So for example, Christmas or Ramadan or high holy days. We have special foods. So there's all these elements when you think about a faith community. There's all these special things, and that's a commonality. We can talk in generic terms about that. And so what we help to do with participants in Faith and Diabetes is we help them to think creatively, well, how am I going to leverage those special things towards health? Whether it's a particular scripture, whether it's a particular food. I remember fondly once we had a group of Muslim women participating in a training, and we started talking about special foods in different traditions. And one of the foods they identified was dates. Dates are mentioned throughout the Quran as a very special kind of sacred food. And there's stories around dates. And what are dates? Dates are basically all sugar. So there's a really interesting way in which we can have a conversation about sugar by using this special part of the tradition. So those are the kinds of moves that we like to make.
I'd like to say I'm very proud of the Faith and Diabetes movement. Faith can be the most polarizing, and if you look at whether it's attending church on Sunday or attending temple on Saturday or whatever your day of observance is, it's noted that those can be the most segregated instances. With this Faith and Diabetes, what I've been very pleased with is that we have targeted leaders and we focused on the commonalities. And in some ways, the diabetes curriculum and the need for us to help improve individuals' lives has kind of given a nice level field. And so where you would see very polarizing behavior in terms of you're Muslim, so I don't believe like you, we are now, as Stuart shared with the example with the holidays, it's like, oh, wow, we have more in common than we realize. So I've been exceptionally proud of the Faith and Diabetes ability to build collaboration and to build community consensus around the disease of diabetes, and maybe even at larger around the whole concept of wellness.
Yeah, and by the time patients make it to us, sometimes they're not feeling well at all, and bringing and meeting them where they're going to be, where they feel more safe. is a really, good thing. One of the things that you were telling me, George, is that there's a collaboration between your faith community and clinics. And I always, always, always love the personal touch, the handoff from one individual to the other. So I think faith and diabetes training allows, those of us who are in the clinical setting to touch base with a lay person who then goes back to their home faith community. And then that faith community can also send, it's just like full circle. Can we talk about how wonderful that is?
Well, I'd have to say from our perspective, just this whole faith and diabetes has been a handoff. And I have to say, Stuart, Joy, Serena, you guys have done a remarkable job of taking this bigger and better than what some of us initially planned. But I do like the idea for us at the Fountain. We believe that we are not the begin and end all of folk. We realize that it takes really a community, or some people call it a village. And so we realize the importance of the medical community in regards of making people well. And so very obvious that when people need, tertiary care services, that they have to, go to a hospital. But again, what I like, we've had instances where we've had to reinforce, say, what a dietitian, as yourself, Joy, has given a person as this is your prescription for wellness, for improving your health. And so when we look at people like Maryanne, who comes from nursing, again, it's very good to be able to refer them back to, after we prayed with them, it's like, okay, we prayed for you. Now you need to go back and talk to your provider. So again, I think that requires humility, but it also requires that your major focus be for the betterment of the patient, or the betterment of a person's wellness.
I just wanted to bring forward something that, so I work in a hospital. I'm in the inpatient setting, and I work for a faith-based hospital system. And so I kind of call it the cradle of care. That's sort of what you were alluding to, I think, George, when you said about the village. So I call it the cradle of care. So we're all along this continuum, and we all help in different, places. I think the importance of the faith is that the spirituality can be in every single part of that continuum, whereas some of the others of us are kind of in our special space. But one thing that evolved and was helped through Cities Changing Diabetes and your interfaith community at my hospital system is we actually had one of our chaplains attend and learn how to teach diabetes. And through help from all of this organization that has been put forth here in Houston, they actually put up a diabetes class. It's mostly in Spanish at a local church. And so what we've been able to do is actually recommend that to some of our patients. So the chaplains will come up and they will talk to the patient, and then the patient can learn about this outpatient diabetes classes. And then it's at a church, and then they go there and do all the wonderful things that you all just spoke of, from, weaving in the scripture and all of that. And then, then they're also helped with continuing on their cradle of care to their physicians. And it just works marvelously. So, it's just such a great inject of having the faith. It's necessary in every part.
Agreed. So how do we, some communities are, some individuals are probably watching this and they're members of smaller faith communities, because we know here and around the country, there may not be large faith communities everywhere, but we do have smaller pockets of maybe smaller faith communities. How is someone who's looking at that, or leadership from that, maybe they feel that they don't have enough infrastructure in order to do this. This sounds like a great idea. They want to help their community. How can they reach out, or can they reach out to fellowship with someone else?
So there's a couple of ways, and I'd like to emphasize right up front that the Faith and Diabetes Initiative and this work and this way of thinking about the relationship between faith and health is something that no matter your size of congregation, the denomination or lineage that you're from, whether you have a health ministry or not, it's something you can engage. So it's really a template that's useful kind of no matter where you are in this work. So that's just something very important. The second thing is we do have a website, faithanddiabetes.org, that you can go to and you can explore some of the work that's being done in Philadelphia and Houston there. There's contact info. I will say just right now that the email address is info@faithanddiabetes.org. And so if you have a question or just want to express some interest, you can go to faithanddiabetes.org or email info@faithanddiabetes.org, which is also listed on that site. So there you go. There's the email address. So, I want to say that we've had experience with very robust health ministries that engage with the Faith and Diabetes Initiative and may not change a huge, kind of process that they're doing, or it might be not some systemic change, but it might be just a creative way of looking at the relationship between faith and health. And that's what they extract from Faith and Diabetes Initiative. On the other hand, there may be people who engage with us who say, well, we don't have a health ministry. We really want to start one. I have this group of volunteers here who all are kind of interested in it too. And we can kind of help make that happen and help frame that work and introduce you to resources and contacts and help create dialogue and conversation about what that can look like. So that's the way of engaging. And if this sounds interesting to you, no matter where you are on that spectrum of robust health ministry or no health ministry, you're welcome.
If I could add, all houses of faith, you have to be very deliberate about accessing what I call the resources. And so, for example, the Fountain of Praise, we've got a little over 26,000 members.
Wow.
We have a very robust ministry or wellness group. And I mean, we've got a large number of physicians, of nurse practitioners, of nurses, social service people. But one of the things that we realize, part of our obligation as a ministry, and this is our call to community, we actually partner with the smaller churches that are in our area. And so when we do health fairs, we actually bring them on as an equal partner, which gives the services, takes the services to their congregation. And again, it is about building community consensus. I might say now we are blessed with a very large group of individuals, but if you can imagine, that in sometimes makes us a little hard for things to get implemented. And so when we're partnering with the smaller churches, we find sometimes they're a little more innovative and they don't have to go through the bureaucracy that we go through. And so it's really win-win for all. And again, if you are community focused and if your church is not, I would encourage you to be community focused. Larger churches reach out to smaller churches reach out to larger churches, and it's win-win for all.
Wow, that's so great. I'm just typing this in here so that everyone can see kind of your words. So fellowship between different communities of faith, size-wise, interfaith-wise, can be used to share in resources. And I think that, that is something that is really fantastic because if you're just one individual, it may seem too big, right? You all can assist with creating a dialogue between leadership. Because sometimes, to be honest, some leadership is, they're very sort of skeptical. If someone wants to come in and do this education, it doesn't mean they're not part of our community, doesn't mean that they want to ask something of our members, right? So as a faith community family, you also want to protect your membership. as well. So I think to have the Faith and Diabetes platform create fellowships and then move forward and reach faith communities that may never have the opportunity for a wellness ministry is really, really important.
Sure.
It's a really important point, Joy. And linked to that is a buy-in from faith leaders. And I, to just reiterate, one of the reasons why I love working with Faith and Diabetes is because we really care about, well, we try to care, and I think we do care about what matters to faith communities most. When someone is called to plant a church or start a church or go to church every Sunday, really what they're looking for is to have a relationship with God, to have a relationship with others who are people of faith. And we don't forget that that's why faith communities exist, is faith communities exist and have existed not just to be kind of used in disaster recovery or in diabetes work or when we want to promote health. Faith communities are there as, sources and cradles for the human spirit. And by walking forward with that understanding first and meeting faith communities where they are, that's when a real authentic relationship begins to emerge.
Yes.
Yeah. And I think Joy will agree, and Serena as well, from, working with people with diabetes. They're often not ready to make changes until they decide they want to make changes. And I just always feel that, having that sense of faith helps them to get that trust and that desire to motivate to go ahead and, continue to try to make those changes. So I know in the hospital, for example, when we have patients that are, having difficulty with that, we'll often call our chaplains in, or they'll call in other faith professionals to come in, and patients will often tell the faith chaplains or other professionals things that they won't normally tell, our healthcare professionals. So it's that sense of trust which helps them to get that motivation. Definitely.
Mm-hmm.
Yes, for sure.
If I could share too, just that sharing is so powerful. And when you open yourselves up, like in the Fountain of Praise, we opened ourselves up, and it goes into other areas, like in social justice, for example. We found ourselves, because again, we've opened ourselves up to the community. We were doing a Black Male Summit to address violence. And one of our main partners was the Nation of Islam, which I never in my wildest imagination imagined that we would be able to do programming collaboration with them. But again, it's like it's diabetes today, and then tomorrow it's a myriad of other opportunities. And so I really, really want to suggest to anyone that's watching this that's at a church or at a household of faith, open yourselves up. Look at the good that can happen when you start to build those bridges and to do the community collaboration. Is very, very powerful.
Mm-hmm.
Absolutely.
We have, of course, some of our viewers who are agreeing wholeheartedly. There are also members and participants right now in the wellness ministries for their faith communities. And we do have a question coming in from Philadelphia.
Okay.
It says, Susan asks, how can faith and diabetes help faith leaders care for their own health in addition to caring for their congregations? And this is that idea, right? It kind of wraps around the idea of trust, but also modeling, right? We all know that modeling is so big in developing trust and developing motivation. Can you all talk about how you've used that theme to develop faith leaders?
There's a story that comes to mind. Well, there's two stories that come to mind. The first is not related to diabetes, but it illustrates the same principle. Is there's a church in Houston that's part of a United Methodist church. It's called Mercy Street, and the pastor that runs and kind of leads Mercy Street doesn't just talk. She walks, and she is very engaged on a very personal level with the congregation, their struggles, and showing that level of kind of intimate care and concern is so powerful, because so often our faith leaders are, people who are in positions of power who can seem kind of untouchable and kind of removed. So when you have someone that really models that, it's pretty important, as you were saying, Joy. But the question was about how faith and diabetes can help faith leaders. And I think one of the main things is that faith and diabetes allows faith leaders to think creatively about their tradition in new ways, that even in seminary, even in training, they may not have considered. So there's this creative emphasis within faith and diabetes around transformation of your understanding. That's what happens in interfaith dialogue.
Yes.
You don't only learn about others' traditions, but you also deepen your understanding of your own, which is so incredibly important.
Joy, I'll be a little transparent with this question. And so during this pandemic, I was eating more carbs, pretty much just growing. And my trip to the doctor showed that I was pretty much pre-diabetic. And so in my faith context, we often quote the scripture, follow me as I follow Christ. And so I realized with doing work with the Cities Changing Diabetes that I had to model the very behavior that I was advocating for. And so I think very often with faith leaders, we have to really push the point to our pastors, to all of our leaders, that we have to lead by example.
Yes.
And so for me, 15 pounds lighter and change in diet, change in some very fundamental things, all of which I learned in the faith and diabetes training, has gone a long way. And now it even improves what I call my testimony. So I can say to others, hey, I did this too. You need to do the same.
Yeah. And to bounce off of that, talking about the faith leaders, the faith leaders, they go through a lot themselves and care for so many other people. And, a lot of times they may even neglect themselves and say, oh, I'm okay. I just got to keep my work going. But I know for me personally, caring for other people can get exhausting. It can be tasking. You forget about your own health. And what will help. So a lot of leaders don't think about how much vulnerability helps their case.
Yes.
When you let other people know, hey, I'm dealing with this too, and this is what I'm gonna do. That's the joy. That's the joy of being a leader, that you can show someone else how to do what it is you're trying to tell them to do.
Yes.
So when I talk in peer support and say, well, this is not for me to just, I want you all to share, but I also put myself into it so that they won't say, oh, this is just somebody that's just telling us what she's probably learned in a book or no, I'm dealing with it too. I can even tell you that I'm not always on point, but it's the fact of keep going and keep trying. If you fall, every time you fall, get up, don't stay down. So faith leaders have that influence to with their people, that people will follow them. People will follow what they do. So yeah, that's the what do you call it? I don't want to say magic, but that's that's what happens when you put two and two together, and your congregants are like, oh well, my leader says this, so maybe I should try it. So yeah.
And part of part of our training in counseling, and really earning and honoring the trust that our patients give us is to be a bit vulnerable,
Yes.
be reachable to people so that you can help them change their lives. And so I think that intersection and that thread runs through faith and diabetes as well, very, very nicely. And I, for one, love telling people about faith and diabetes. And I've actually had some of my own patients go through the training, to take it back to their communities of faith, and to be able to hand someone off to your team to further their growth, so that now they're talking about their health and they're being these faith leaders and they're trusted in their communities. And so they in turn are also learning as they're training and teaching their communities. It's just, I feel like all of these things are together. I could just put in a big bucket, like cradle of care, faith and diabetes, trust, communities, spirituality, all of that goes hand in hand. And it creates a platform for an individual to completely change their lives, right? So from the outside in and around them. And that's what really, I think, most people need when dealing with diabetes, or really any chronic disease.
Right. I think you're right with any chronic disease. And, there's that depression that comes on when you're dealing with a chronic disease, whether it's diabetes or others. But, it's a day-to-day, moment by moment. I often tell patients that diabetes is the thinking disease, because what it does now is it makes you stop and think about everything before you do it. And after a while, that becomes overwhelming. We normally do think about things before we do them, but we don't seem to realize that. But when you have a disease like diabetes, it really brings it forward, because it's just an integral part of being able to take care of yourself. And nobody likes to think that they have to think about things before they do it. But having that faith to turn to, especially when you don't have a good day where you were able to do what you wanted to do, and that faith, so to go back in and and get yourself centered again is so important.
Yes.
Right. And I'm gonna be in peer support mode now. George, yay! You know how hard it is for people to talk about, to say, yeah, I'm dealing with pre-diabetes. Yes, I ate too many carbs. That's hard for people to do. So
yeah, yay!
Thank you, Serena.
Yeah, we're all fighting the human things with especially with wanting to eat more carbs during COVID. I haven't heard anybody that hasn't had that challenge. So
yeah.
And I have some great models. Our senior pastor, Dr. Remus Wright, and co-pastor Mia Wright, they are like the pictures of health. And they're very faithful about working out and the like. And I just had a recent discussion with Pastor Wright, and he said, I go to do my workout. I'm faithful with that. But, the whole stress of this pandemic, we've got to do more to address that. And so, the caller, or the person that asked about that question, again, Serena, you said it so very well. Faith leaders have pressure on them that people cannot understand. And so I think we all have to find those good examples and run. Now, I look at my pastor and first lady, and sometimes our co-pastor, and say, oh, wow, man, how can I get to where they are? But it's step by step. And so I'm excited about that journey, and excited about where this whole process is taking us.
Right.
So currently, are different faith communities reaching out to their members virtually, like we're doing now, where we have kind of conversations? Do you all know?
It's become survival for us at the Fountain of Praise, and so we early on decided for the safety of our members that we would not do in-person fellowship or joining. And so we have spent a considerable amount of energy and resources in perfecting our online and our electronic engagement, as I like to call it. And it's really opened up some new doors. What we at first were a little distressed about because we couldn't come together, we now are realizing we're able to reach more people and we're able to get more messages out. So we're actually at the Fountain having a lot of fun with that online. And as we put it, we can now talk to the world, literally, through the internet. So we are finding too that we're getting lots of calls, lots of inquiries about, things as simple as how do I wear my mask? What masks are appropriate? How do I avoid COVID? We've even had instances where people are reaching out to us as like, hey, I have COVID. What do you recommend? And so we've had a lot of engagement electronically, and it's been very positive.
Stuart, I feel like you wanted to say something.
It was something sort of off topic. It was something I was thinking about since the last question. But since we're talking, I think it's important to remember too that faith health work it's a two-way street. It's always a two-way street. So often these conversations get framed in terms of, well, how can we draw upon spiritual and religious resources to enhance health? But if we flip that, turn it over, the other side of the coin is how can we draw upon health to enhance our experience of faith and our religious traditions and our spirituality? So, it's both. It's a both and. When we draw upon our religious communities for support, when we take advantage of offerings like health fairs and diabetes prevention programs and self-management classes that our communities of faith might be offering, that's going to make a difference in our health. But then the fruits of that, the spiritual fruits of that, are that when we become more healthy, we're able to experience our traditions in a more robust, whole way, which is really beautiful. We had a smoking cessation program come to us about 5 years ago and ask, well, we want to use communities of faith to get the message out about smoking cessation. And kind of immediately asked them, well, can we also think about how stopping smoking might enhance your experience of faith? Maybe you don't have the jitters as much when you're in a service. Maybe you're more clear-eyed when you're reading scripture. Maybe not thinking about that when you're engaging in a prayer or worship practice. So that's the nature of the two-way street, and it's exciting. It's exciting.
It's a great point.
Yeah, that is super. I love that. I feel like I learned something amazing from you, or I received something great and sort of poignant every time we have a conversation. So you said when we become more healthy, we can experience our faith more robustly, and that is just wow, what a statement.
Yeah.
And Joy, if I could add to Stuart's point, it can grow to something even more what I call miraculous. Just talking about smoking cessation. We did a smoking cessation program in the church, which went very, very well. Our wellness ministry coordinated it. And what that grew to, it grew to the congregation's awareness of smoking. And so a couple of years ago, we participated with a petition to increase the tobacco age to 21. So probably not realizing it, but our congregation went from let me better and improve my health really to one of influencing policy.
Wow.
And so again, I think this opens up just faith and diabetes opens up just a wonderful world of opportunities for us to impact the community. And so, we find that too when we're now looking at, some of the comorbidities of COVID. We're looking at, hey, we've got to look at not just diabetes, but hypertension and other cardiovascular diseases, and moreover, start to influence policy, and in some ways look at opportunities to do research so that we can better improve. So again, to Stuart's point, it is a two-way street, and again, just great opportunities for us to seize.
Wow.
So would you say that it should be an imperative for faith communities to prepare themselves to receive health education and to give health education? Would that be a fair statement?
I say if you reject that notion, you reject your sacred text.
Wow.
All of your not only kind of give us guidelines, but those texts call for us to serve and to minister. So yeah, it's imperative.
Right.
And it's just like when you're on the plane and they're giving you the safety instructions and they tell you that, make sure you put your own mask on first. Well, it's the same thing here. I mean, if you aren't feeling well, how are you going to help take care of anybody else? So, we have a responsibility to take care of ourselves so we can do the work we're here to do.
And one another.
And
Yes.
Maryanne, for those churches that don't get that, I've shared with our leadership that, okay, so maybe you don't buy into all of the you should for the a good reason. But if you have sick people, they're not going to be able to financially support your church.
Yeah,
They're not going to be able to run the church. And again, it is, I think, important to our survival as households of faith that we push that our people be well. If they're well, they can volunteer, they can give in offerings, they can do all the wonderful things that we do as churches. So. Joy, Maryanne, to your point, it is absolutely a requirement.
Yes.
I believe younger generations want to engage. We're socially minded. There's more interconnectivity and integration between different aspects of life. And just really, from a practical standpoint, I would encourage all communities of faith to kind of pay attention to that and realize that probably might be losing some members if you're not paying attention to these social issues, health issues, because there's other ways of engaging those things.
Yeah, agreed. And I think that, having faith in diabetes, making these toolboxes, these sessions, these trainings available helps to, just like, for Maryanne and I, we have continuing education, right? Mm-hmm. So my expectation is that when a patient comes to me and they're asking for help, okay, it is my responsibility to stay up on technology related to diabetes, stay up on medications related to diabetes, so I can give these people who have come to give me their trust my 110%, right? And so I think that, from, like you were saying, Stuart and George, from a faith community standpoint, if we know that 1 in 4 people are going to ask their faith leaders first before they go to a health professional, faith leaders need to say, super, I'm here, I'm available, and I have resources for you.
Yes.
Because, like you were saying, Stuart, the youth, like our generation, are asking for give and take, right? We want to give, we also want to receive. There's so much of, like Sandy is saying here, serve and minister at the same time,
Yeah. I always share with people that, how can you, say, okay, I'm called to go do this. This is my mission. This is the mission that God gave me, but you're sick. It's kind of hard to do all that you can do if you're from a hospital bed, you know.
Right.
So I always say, well, in order to do what you're called to do to the glory of God, you have to be at your best. And you can't be at your best if you're neglecting your physical body, you know. So I always express that to people. And we've tried to, even Joy, you've done a event with me at my church. We did a diabetes awareness day. That was so fun. People are still talking about it. At my church, and I forgot, my church is Impact Kingdom Center, Pastor Dexter Utley. We have Fun Fit Sundays too, where praise and worship is, we have a personal trainer in our congregation. So praise and worship is like exercise, you know, it's like an exercise.
Great.
Like that. It's like stuff like that can really make the whole difference in a congregation's, you know, thought process about their physical health.
Yep.
And so that's why faith and diabetes is so important. I love it.
And I think people wouldn't normally participate in something like that unless they were in that safe space of being within their faith community. So people that normally wouldn't be motivated will be motivated because they'll feel in a safe space. I think that's just awesome. That's the best thing I've ever heard. Great.
And like you were saying, Serena, you know, I really enjoyed coming to your faith community and sharing in the way that, you know, they see faith and in the way that health wrapped around it, right? And so I needed to be ready for them and their questions. And one of the things that, you know, comes back, if you are, so I'm a dietitian, I'm a certified diabetes educator, and growing up in our faith community, there was always, and just in my own family, there was always this expectation that you would give of your specialty, of the things that you can do, the things that you've learned, to others in your community. And that in and of itself can be a massive bomb. You know, this is why I volunteer. This is why I steward, so that I can help other people. And by doing so, uplift myself, right? Internally and spiritually. I feel best when I'm helping someone else. And so to utilize people like you use Fit Sundays, you're motivating that physical trainer in your faith community to help others. And by doing so, that individual grows as well. And so different faith communities have nurses in their membership. They have physicians in their membership. It is just incredible to see how faith and diabetes spreads throughout faith communities to help people help each other, help themselves. It's just so beautiful. I'm going to stop there because I could just keep going. So before we leave, these are just some pictures of different faith communities and how they're protecting and allowing their members to still experience faith in their locations, sometimes across the world, actually. So these are just, I saw that and I just thought, what beautiful way to include all faith communities in our conversation. And
you know, when you're suffering, like we are all suffering now going through COVID, by being able to go and help in some capacity to help somebody else, really, as you said before, Joy, I mean, just is so comforting and helps us cope as we go through this as well.
As well as, Maryanne, bridge that gap of isolation.
Yes.
I always tell our congregation, it's not about being socially isolated. Let's socially distance and do the mitigation factors, but we don't have to be isolated. And so even with this faith in diabetes, it opens up the door for connectivity so that people are not feeling isolated.
You're so right. Yeah. And to that, Serena's support group, I mean, just can't say enough about, you know, the good work that her group is doing, because it's just so important and such a value in both perspectives. Yeah.
Yes.
Thanks, Maryanne.
Yeah.
I'm your fan.
So in parting, I know we're getting towards the end here. Let's see if we have any last minute comments. But then I also want you all to leave us with a parting thought, either how faith in diabetes has changed you, how you've seen it change other people, just anything that that you think viewers should know as we wrap up now about faith and diabetes and about the the collaborative work that they're doing, the ways that faith and diabetes is changing lives.
I can go first. I just came to mind that by watching today, by being interested and engaged, you are automatically a health ministry of one. And each of us have so much power to affect incredible rippling change in ourselves and in others. And so just by being here today, just recognize that. Take a moment and recognize that you are engaging right now in health ministry, and you're engaging right now. You're part of the Faith and Diabetes Initiative right now.
Right.
Yes.
Yeah.
Faith in Diabetes has affirmed a few things for me, and I'm actually very joyous. One, it has affirmed my belief that when you give of yourself and when you decrease, you can see God work. And so when I look at this whole Faith in Diabetes initiative, what started out as, a few of us, our brainchild, actually has grown into something that is impacting the world. And, when I see that the Faith in Diabetes team has done work in Canada, and when I look at the fact that you're expanding to Philadelphia, it affirms to me that as we as faith leaders have to look at big picture, and we have to look at, how can I spread the message? And again, in my faith context, that is what Jesus did. Jesus made disciples. He made people and planted seeds for them to grow and impact the world. And so I am just overjoyed with what has been accomplished through Cities Changing Diabetes. And I always say that Novo Nordics, again, hats off for your approach. And when I look at Cities Changing Diabetes, Klaus Karen, just awesome way that you have led this group for such a time as this. And I'm just overjoyed.
Yes. What initially attracted me to Cities Changing Diabetes was the Faith in Diabetes initiative. That's how I got started. And it attracted me because of the connection between faith and diabetes. I'm just so excited that everything has spiraled into, this is like a passion and a drive for me now. And now we're doing peer support and Joy, shameless plug. You are a part of Facebook. Please go to the search bar and type in Houston Diabetes Peer Support Program, and the page should come up, and you send in a member request, and one of the admins will let you in. This is a group that you want to be a part of. We give tons of information and support. But yes, I'm so glad to be a part of the group. I love working with Stuart. High five.
Like box high fives all around now.
Yes, this I love it. I love this work. It's great and very rewarding.
And
Hey,
Maryanne,
Serena, your Facebook page is good not only for people in Houston too, right? Just because it's called Houston Peer Support Program, other people in other cities could find useful things on there, I imagine.
Yes, they could. They could as well. They could. Yes, definitely.
and I'll let Maryanne speak about being a clinician.
Well, in all the years, it's been over 20 years that I've been, working in diabetes in this capacity, and I've worked and lived all over Texas. So it didn't matter what city I was in. I found myself involved in the diabetes and faith community, although not as formalized as we are so lucky to have it here in Houston. But I was asked not too long ago by my little Bible group that I belong to, and I'm the only healthcare professional in the group, and they were asking about different ways that they could do their own personal ministry. And so when they came to me, I said, well, I think I do it every day. I'm so fortunate, first of all, as I said before, to work for a health system that is faith-based. And so we are allowed to pray with patients at the bedside. So, you know, I am blessed. God has given me the opportunity to do work, my daily work, and also feel like I'm doing a ministry as well. So it's that important to me.
That's super. I'm always looking for ways that my patients can receive health and complete and total wellness outside of the clinic, right? And so I think Faith in Diabetes allows that, you know, that teaching to go on. And I'm so grateful for you all. Truly, truly grateful. Thank you.
Thank you.
And to all of our viewers, Sandy, Dina, Susan, all of our viewers, all of our guests, I'm really so appreciative of your engagement and of you taking the time this Saturday morning to meet us. And it's time to say goodbye now, but I'm sad. I don't want to go. But thank you all so much, so much.
Great.
Thank you. Bye.
Thank you.
Bye.
Bye, everyone. Thank you so much.
Bye-bye.
So this has been a great start to a Saturday morning. As you can see, some of our viewers have mentioned, with yet another incredibly talented panel of guest speakers. This has been, no pun intended, an enlightening episode about engaging people about their health through their faith community. I hope that this conversation stimulates you to think about your faith community in a different way, and perhaps even encourage you to reach out and to help out. Continued gratitude to all of our viewers, and as always, thank you to my guests and my friends and colleagues who have taken time to share this morning. Mark your calendars, everyone. We will be broadcasting again every Saturday, 10 a.m. Central and 11 a.m. Eastern Time. Our next episode will air on Saturday, August 22nd, when Hope Galvan with Harris Health will explore the concept of food as medicine with us and share her experiences of working with the Houston Food Bank and other organizations to reduce food insecurity among Harris Health patients. Thank you, everyone, and I hope that you feel you are now part of the MyDiabetesHQ community, and also that you are engaged in the faith and diabetes community as well. See you next time.